Let's have a quick revision of life cycle of Taenia solium. It is the same as that of Taenia saginata, and there is just one difference of intermediate host, and the larval name is different. So if the uncooked pork is eaten, so finally there would be formation of adult worm, which is actually going to mature and would release eggs in feces with the gravid proglottids, and they would be taken up by the pigs. Now, inside pigs, there would be formation of oncosphere, and cysticercus cellulose is going to develop inside the muscles of these pigs. And if they're consumed, again, the cycle would be repeated like this, as you can see in this picture. Now, please remember at times the ingestion of contaminated food or water with eggs is going to produce a condition which is called as cysticercosis. If you remember the larval form, which is known as cysticercus cellulose. So the mode of transmission for cysticercosis is either by ingestion of contaminated food or water with eggs, or there can be a man harboring the adult worm may auto-infect himself due to unclean and unhygienic personal habits, or they can be a reverse of peristaltic movements of the intestine, whereby the gravid segments are thrown back to the stomach. And this is again equivalent to swallowing of thousands of eggs. Now, these eggs are going to develop into cysticerca, which can straight away settle into different body organs, for example, brain. Usual location is muscles and subcutaneous tissues, and these dead cysticercae can produce inflammation and they can become calcified. So, in case of adult tinea, the adult worm, there is little damage, if any, in small intestine, but the larval form is going to produce a very devastating effect. The larval form, which is called as cysticercus cellulose. So I've just mentioned the mode of transmission of this cysticercosis. So the dead cysticercae can become inflamed and later on can become calcified. So the Taenia solium adult worm would be producing asymptomatic infection, probably loss of appetite and diarrhea, but the larval form is going to produce cysticercosis. Now, if brain is involved, this is called as neurocysticercosis. So the larvae can grow to huge size, especially in brain, and this presents as a space-occupying lesion. Dead cysticercae can produce an inflammatory response and they can become calcified, and you can find these signs and symptoms like headache, vomiting, and seizures. Similarly, there can be cysticercosis of eye. It can present as inflammation of uveal tract or retina, or it may be uh, seen as a single cyst which is freely floating in the vitreous fluid or under the retina. Then the cysticercae can be um, um, palpated as subcutaneous nodules, and finally we come to the lab diagnosis of Taenia saginata and Taenia solium. So we are going to do this lab diagnosis of Taenia saginata and Taenia solium together, just like in case of life cycle. The stool examination involves macroscopic examination in which you can see the fresh gravid segments or the head region through the naked eye, and you can also prepare a smear of feces and you can observe the oviform, and in some cases where the ova are not easily seen, then you can use certain techniques like there is a sedimentation technique in which you can use solution of low specific gravity than the parasitic organism, and this would concentrate the parasite in the sediment. Then specifically, molecular methods include PCR. So this is the ova of Taenia species. These are the hooklets, three pairs with embryo containing radial striations, and this is brownish in color. So all of these are ova of Taenia. How would you diagnose this cysticercosis condition? Now it depends where the cysticerci are present. If it is going to involve the subcutaneous area in the form of nodules, so you can go for biopsy. You can perform CT scan or MRI if brain is affected, and you will find calcified cysticerci in brain. And you can also perform X-ray of buttock and thighs if the cysticerci have settled over there and the eosinophilia may reveal invasive stage. Similarly, you can perform ELISA, which is enzyme-linked immunosorbent test, and indirect hemagglutination tests using antigen from pig cysticerci. So the immunofluorescence and ELISA tests are now widely used for detection of antibodies. Similarly, you can detect antigens from serum and CSF, and this is again by ELISA. Diphyllobothrium latum. This infection is common in those areas where the raw fish is eaten. Humans are the primary hosts and they're going to have adult worms, whereas there are two intermediate hosts. The first one is the crustacean or cyclop, or you can say the cyclops or the crustaceans are the arthropods, mainly from aquatic group. And for instance, the crabs, lobsters, shrimps are included in this category. The second intermediate host is the fish. And what are the signs and symptoms? There is a very important finding. This produces megaloblastic anemia. If you talk about malarial parasites, they produce hemolytic anemia. And this is because of this diphyllobothrium is located in the proximal part of the small intestine and contains a considerable amount of vitamin B12, and they may deprive most of their nutritional component and can produce symptoms like there is heart palpitations, shortness of breath, pale skin, nerve problems like numbness, tingling, muscle weakness, vision loss, depression, memory loss, or behavioral changes, and you can find the eggs or segments in feces. We are just quickly going to have a look at the life cycle of this Diphyllobothrium latum. So the raw fish is consumed, and once it is consumed, the larval forms, which are called as plerocercoid forms, they reach the small intestine and the larvae attach to the gut wall and develop into adult worms. Now the gravid proglottids, they are released and the fertilized eggs through the genital pore, and the eggs are then passed in the stools. The immature eggs must be deposited in fresh water for the life cycle to continue, and the embryos emerge from the eggs and are eaten by tiny crustaceans, like for example the cyclops. And the embryos are going to differentiate and form the procercoid larvae, and the crustaceans are going to be eaten up by fresh water fish, for example pike, trout, and the larvae differentiate into plerocercoid in the muscle of the fish. So this is the second intermediate host. So these plerocercoid are present in the muscle of the fish, and this cycle is completed when the raw undercooked fish is eaten by humans. So the Taenia infection is acquired by humans through eating contaminated pork or contaminated beef. It depends whether it is Taenia saginata or Taenia solium. The cyst, once it develops inside brain, it is called as neurocysticercosis. About 30% of epilepsy cases are in the endemic areas where the people are in close contact with the roaming pigs. Thank you.